USMLE style question on hyperthyroidism and increased basal metabolic rate. Question: a 32-year-old woman presents to the clinic with unintentional weight loss, heat intolerance, palpitations, and increased sweating over the past 3 months. She also reports increased bowel movements and anxiety. On physical examination, her heart rate is 112 beats per minute, and her skin is warm and moist. A goiter is present. Laboratory results show low TSH and elevated free T3, T4 levels. Which of the following best explains the increased basal metabolic rate in this patient? A. Increased expression of beta-adrenergic receptors. B. Increased NMDA-ATPase activity. C. Increased glucose uptake by skeletal muscle. D. Direct stimulation of mitochondrial ATP production. E. Increased peripheral conversion of T4 to T3. Answer B. Increased NMDA-ATPase activity. Explanation: this patient has hyperthyroidism, most likely due to Graves' disease, given the presence of a goiter and systemic symptoms. Pathophysiology of increased basal metabolic rate. Thyroid hormones, T3 and T4, increase the synthesis of NMDA-Kpase ATPase, leading to increased ATP consumption, increased oxygen consumption, increased calorigenesis, heat production. This explains why patients with hyperthyroidism experience heat intolerance and weight loss despite increased appetite. Why not the other options? A. Increased beta-adrenergic receptor expression occurs in hyperthyroidism and leads to tachycardia and anxiety, but does not directly increase basal metabolic rate. C. Increased glucose uptake by skeletal muscle. Thyroid hormones enhance glucose metabolism, but increased BMR is primarily due to NMDA-Kpase ATPase upregulation. D. Direct stimulation of mitochondrial ATP production. T3 influences mitochondria but does not directly stimulate ATP production. E. Increased peripheral T4 to T3 conversion, important for thyroid hormone activation, but not the main reason for increased calorigenesis.